Hi everyone, my name is Dr. Mark Tunzi. I'm a family doctor here at Natividad, and on behalf of everyone here at the hospital, we hope you're staying safe and healthy during this unprecedented, difficult, and challenging time. Here at Natividad, we're working with the Monterey County Health Department, the California Department of Public Health, and our other 3 local county hospitals to try to reduce the spread of coronavirus and keep us all well. We are all in this together, and our top priority is to keep our community healthy. We would like to share some information for you about coronavirus to help you protect yourself and your families and help reduce the spread of the virus in our community. We'll also tell you when to come and when not to come to the hospital. Most people with mild symptoms don't need to be seen. We've made the following video to help you and your families, and we hope the information will help us all stay safe. What is coronavirus? We are seeing a new virus called the novel coronavirus, or COVID-19, coronavirus disease 19. It's related to the common cold, but it's not a common cold. Like the cold, it can cause a cough and sometimes a fever. For some people, however, it can cause great difficulty breathing and require hospitalization. For some, it's deadly. Those who get the sickest tend to be those who have pre-existing medical problems, weakened immune systems, or are over the age of 60. Like the cold, coronavirus can be spread by contact with people, we think via droplets from your nose and your mouth. So cough, snot, spit. How to protect yourself? There are a number of things that we can do to try to protect ourselves. First off, wash your hands. And when you're done with that, wash them again. If you have hand sanitizer, use it. Otherwise, soap and water, 20 seconds. Wipe down surfaces. It's not exactly clear how long coronavirus may last on different surfaces, but if we wipe them down, it's still safer. Avoid touching your hands and face. If you have a droplet on your hands, it's going to get into you only if you touch yourself, particularly the face, the nose, the eyes, the mouth. Wash before you scratch. Cleaning and disinfecting surfaces in general I mentioned. Social distancing. So, because we think the virus is carried via droplets, and droplets can only go so far, if we maintain 6 feet distance between each other, we can try to help prevent the next person from getting the virus, even if we do cough. Consider delaying travel. Don't gather together in groups. If you're in a high-risk group, people with pre-existing conditions, particularly weakened immune systems, and those over age 60, use extra caution. What should you do if you get sick? The most important thing, if your symptoms are mild, is to do your best not to infect other people. Stay home. Take over-the-counter medications to treat mild symptoms. Part of the problem with the coronavirus is that the symptoms are like the common cold. If you have cold-like symptoms, for now, assume it is corona and do all the things that we've already talked about. Wash your hands, clean surfaces, maintain different distance, and stay home. The CDC, the Centers for Disease Control, has a list of things that they encourage us to do, and I'm going to read from their list. Restrict activities outside your home. Do not go to work, school, or public areas. If you need to go to the market, if you need to go to the pharmacy, if you need to perform an essential task, fine. Otherwise, stay home. Avoid using public transportation unless absolutely necessary. Wear a standard surgical mask around other people, if you have one. The hospitals are running low. And again, you only really need to use a mask if you are sick and coughing or sneezing to try to protect other people. Cover your coughs and cover your sneezes. Use your hands, but then go wash them. Use your elbow. Wash your hands often. We already said that. Wash them again. And again, consider the use of over-the-counter medications and pay attention to your symptoms. When to see the doctor? In general, if your symptoms are mild, just like the cold, you don't need to see the doctor. If you're not sure, call. We urge people to use the emergency room and even go into the doctor's office only if you feel like your symptoms are getting significantly worse. The emergency room, in particular, needs to be free for very seriously ill people. Don't go to the ER. If you're not sure about your symptoms and you have a doctor, call your doctor's office, but don't just go in because you increase the chance of actually getting the disease from someone else if all you have really is just a cold. And if you do have coronavirus, you increase the chance of giving it to another person. Hospitals are filled with sick people. They're more vulnerable. Let's try to keep them all safe. If you have difficulty breathing, with a cough, and with a fever, you need to be evaluated. If you're not sure what to do, again, call your doctor's office, call urgent care, call the hospital emergency department, call 911 if it's a true emergency. It's also important for you, if you go out and you're sick, to cover your coughs, wear a mask if you have one. If you don't have a mask, use a scarf, cover your mouth, try to keep other people safe. Natividad's fellow providers, the other hospitals, doctor's offices, the county health department are all working together with the CDC to figure out the best steps, try to figure out who really needs to be tested with the availability that we have. One last word about people at high risk for coronavirus. If you develop a cough, a fever, and difficulty breathing, you should seek medical attention immediately. You still might want to call first to be sure that your symptoms are severe enough to come in and to get some information from the doctor's office or from the emergency room. But if you have cough, fever, and shortness of breath, you are at risk and should consider that what you have is the coronavirus. If you are at high risk because of age, over 60, or because of pre-existing medical problems, chronic heart disease, lung disease, kidney disease, diabetes, please call if you're not sure about what to do. But if you have cough, fever, and shortness of breath, you need to be evaluated. Finally, if you have general questions about coronavirus, please call the General Information Hotline. If you have more specific questions, the Monterey County Health Department has established a coronavirus hotline, 831-769-8700 for the Monterey County Health Department coronavirus hotline from Monday through Friday, 8 to 5. We're all in this together.